Hi, Minesh Baxi here, and I'm really excited to be here with Dr. Jeff O'Boyle because what you're going to get today is great education, something that everybody should know if you care about getting quality health care at extremely affordable price. You don't want to miss learning from our guest today. So Dr. Jeff O'Boyle, thanks for coming.
Thank you for the introduction and thank you for having me. I appreciate this.
Yeah, you are in Troy, Ann Arbor. You are right here in Troy today, and it's like a long drive, but you chose to come and educate people. So thanks for doing that.
No problem. Thank you for having me again.
Fantastic. So let's just start with a simple question I have. You told me that there was a FedEx driver who was struggling about healthcare. Tell me his story because that was very inspiring.
Yeah, so this is a a classic story, and unfortunately, I think it plays out across America and even in our communities here more often than we think. And what happened was I was getting a delivery to my medical office, just some basic supplies, and the FedEx driver who delivered them said, hey, you notice the placards on my wall. It says, hey, you're a doctor here, and I said yes. He says, do you accept new patients? I say, of course I am accepting new patients. He goes, well, I don't have any insurance. How does that play out in your office? And I say, well, actually, my office would be a great fit for you because I don't bill any insurances ever. So whether it's the BUCA insurances such as Blue Cross Blue Shield, United, Cigna, Aetna, the government insurances such as Medicare or Medicaid, I don't bill any of them. And I say I offer all my services as sort of a membership for care model called direct primary care. And he said, he's extremely interested in that. And what he told me is that even though he's delivering packages for FedEx, he's an independent contractor that subcontracts with FedEx. And so through his independent contractor, he had no health insurance. And here's a young guy, approximately my age, and he said, he needed to see a doctor because he was battling what he thought was an ear infection, just having extreme pain on the left side of his ear. And he told me he was so desperate that he was going to go to a pet store because he read on the internet that you can go to a pet store and buy antibiotics for fish that you would normally just dump in a fish tank, and instead of consume those, and he had no clue what he was going to buy, but only hoping that it would help his ear because he could not afford, going, to an insurance-based fee-for-service doctor. And so when I saw him, I explained how my clinic worked. He finished his shift around 4 o'clock, came back, late afternoon, saw me the same day that he found out about me. And, I was not only able to sign him up, assess his left ear, which should have a, infection, what we call otitis media in the left ear. And I was able to prescribe him antibiotics from my office that I sell wholesale to my patients for less than $2 for the prescription. So, that to me is a success story where a guy, who's going to buy fish antibiotics, I don't even know where to start with that. And I was able to get him, into the healthcare system, seen by myself, a board certified family doctor, and prescribed human medications for less than a cost of a soda at some places.
I totally agree. Definitely less than Starbucks latte.
Yeah.
For sure, for that matter. So let me just recap the story here for people. Here is somebody who does not have health insurance. Right. He comes to you. He finds out that you do not actually need life insurance to be obviously. Yes. Sorry, I keep talking life insurance. Sorry. So health insurance is one of those things that he doesn't even have to take your services, and then it costs him so little compared to what he normally does. Isn't that amazing?
Yeah, that's sort of the tenet of what my practice is making healthcare affordable, accessible, and authentic to everyone in my community, not just the people who have insurance, but everyone.
Isn't that amazing? So let's talk about the 2-3 things which are going to be critical in our conversation so people can tune in and understand what we are really talking about. The first group of people are like this FedEx driver. They have no health insurance, and they are really looking for care, and they want to find somebody who is going to be giving them that care at a price they can afford, because obviously the reason they don't have health insurance is because it's too expensive for them. Would that be true?
Yeah, I think that would be an accurate assessment. Most people, if you go on the marketplace to look for insurance, first of all, just understanding the difference between co-pays, premiums, deductibles is frustrating enough, and the healthcare system is so confusing that a lot of people just don't even get into it for those reasons. But for most people to afford any kind of health insurance, you're getting some high deductible health plan. In which case, yes, you have your co-pays, but then you're going to get that quote surprise bill in the mail a couple of weeks later saying, "Hey, you owed a balance on this." And people, for the most part, they can't afford a $140 office visit for a $16 prescription. It just doesn't make sense.
And again, these insurance premiums are so high, and I think people say, "Hey, I can't afford that," and then obviously, like you said, going and getting some small prescription for $16 and going through this process. So that's the first group of people who don't have any health insurance and they're looking for quality care at affordable prices. So those are people you can help right away.
Mm-hmm.
Let's talk about the group of people like me who do pay decent amount of money for health insurance, but my deductible for the family is over $16,000.
Yeah.
So there is no way that I won't, unless something dramatic happens. I hope not, and I won't use it.
Yeah, so I'm right there with you. I have health insurance. In fact, I encourage all my patients to eventually get some type of health insurance, although it's not a requirement for my clinic that they have it. But I say, accidents do happen, the incidentals in life, such as surgeries or hospitalizations, and those inherently can be expensive because my program through my clinic does not cover any of that. It's simply just an outpatient clinic where I provide health care through my clinic to people. But I'm in your exact same scenario. Both me and my wife, we have what's called catastrophic coverage, where, us combined, we have a $15,000 deductible in order to keep our monthly premiums low. One, I cannot afford $15,000 if that would ever come to this out. Even as a physician, making what I do, and that's an insane amount of money. But I always say, well, if I got into a situation, say I fell off a ladder, or I didn't get hospitalized, something's better than nothing.
Correct.
But it makes it, seeking normal preventive type care,
yes,
well visits, or even acute things such as a rash or a stomach ache, or the typical upper respiratory congestion we might be seeing this time of year, prohibitive to do. I don't want to go see a doctor if they're going to charge me $200 for 8 minutes of my time, right? And so a program like mine, where you're paying a low monthly fee every time, maybe in conjunction with that high deductible health plan, where you have that insurance in your back pocket for the what if scenarios, but you're able to cover 95% of your medical needs at an affordable rate through something called direct primary care, which is what my clinic does.
Exactly, and we'll dig into that a little bit more here. Before we go further, the third group of people I want to target are providers.
Yeah.
Because a lot of doctors hate the shackles that they have to be under in order to be getting paid by insurance, maybe sometimes 90 days later, or however long it takes, and they may not get paid what they thought they would get paid, and they suddenly become employees of the system while they were really looking to be a doctor. Yeah. And I think people like you have created that opportunity for other people to follow into that business model as well. So tell me, so that people can understand very simply enough, what is a direct primary care physician?
Well, a direct primary care, that's a great question. A direct primary care physician is just a normal physician that you would find anywhere else, in a hospital, based, system, but we are independent. Right? The great thing about my clinic, I love what I do now because I work for my patients. It is so refreshing waking up every day, and when a patient, calls me, texts me, emails me, that's my investment. That's my patient that I'm taking care of, not part of a big health system where, if I'm on, vacation one day, or, I'm, not in my office one day, it just goes to my colleague who may not even know my patient, ends up giving them the wrong, advice or wrong medication, or changing things in a way that I would not, recommend. And, this is, all doctors, whether, we work in a hospital system or you're independent, such as myself, I think we all get into it for, the reasons, that we want to provide patient care, and, we want to help people, and, we're really dedicated towards what we do. But I think a lot of us, especially after we finish what's called our residency or postgraduate studies, you end up working for a hospital, and your name is on the door, but you're not making any real decisions, right? It's the administrators who say, no, this is who we're going to provide care for. This is how many people you have to see a day in order to get that kind of salary, and it puts a stress, right? The patients, instead of sitting in front of them and just having a conversation, it almost becomes an automatic system where you got one concern, that's all I got for today, and make it quick. And if there's any follow up, you got to come back. But as a doctor, it's incredibly frustrating because I'm human, just like anyone else. And when I see, my hospital colleagues telling their patients to come back later on that week or next week for a follow-up and something they could have done in the same office visit, I say, hey, that's another half day off of work that person now has to take, or another half day worth of wages that they're not going to get. Right?
Yeah.
And so it's incredibly taxing and heartbreaking from a physician standpoint. So getting, back to, I think your question is that getting some of that independence, right? And, being able to own up to our patients makes it incredibly, rewarding for me, because, I don't have a big hospital's name to hide behind. It's my name. And just like any other business, it lives and dies by my service. Right.
Exactly.
And so my patients, hopefully, if you Google Beyond Primary Care and you see my reviews on there, you can see hopefully many of them love what I do. It's personalized, it's authentic, and it's comfortable. It's something where people can feel at peace in their own skin when talking to a doctor, and not feel like you have to rush everything out in 2 to 3 minutes.
Very interesting. And I think that's a very good point that you're mentioning, because a lot of people don't understand how the system works. Because they're like, the moment they think of health insurance, they're thinking healthcare. You and I know the two things are different. Can you expand on that?
Yeah, so this is something when I first opened my practice, I would talk about a lot. Is that in this country we intermix health care and health insurance as if they're one and the same. But as you know and I know, there are two separate things. Just like cars and car insurances, two separate things, or homes and homeowners insurance is two separate things. As an example, I'm not using my car insurance to replace my windshield wipers, or get new oil
car
change, or get new tires. I pay cash for these things just like everyone else, and I expect market prices for these services. In healthcare, for the vast majority of our care, that does not happen. People, assume that you have to have health insurance to get any kind of health care, and it shocks people to understand that they can see a doctor, they can get, every blood work, lab they can conceive, most medications, especially the generic ones, and all the imaging done at wholesale prices. So if you look at, where I'm in Ann Arbor, U of M's the major hospital over at Ann Arbor, for example, they're charging, I believe it was over $4,000 for a low back MRI,
wow,
right? That's what they call the charge master rate that they list on their website. I tell my patients I can get the exact same MRI for them read by a radiologist for $290.
So let's just break down that one, because I think let's take a breath and make sure the people are really paying attention here. So let's go back to the rates that you mentioned. So there is a rate which is the University of Michigan hospital rate, and there is a rate that you have access to. So tell us, repeat that, because I think people need to really pay attention.
Yeah, so what the hospitals a lot of time will advertise on their website as part of their effort to be transparent is what they call the charge master rates. All right, if you look at them, whether it's the blood work that you're looking at, or even imaging such as CTs, ultrasound, MRIs, X-rays, we're talking anywhere from a couple $100 to a couple $1,000 in that last example I gave you. And yes, your insurance may negotiate with the hospital and bring it down to say $2,000 or $1,800. But I tell you, hey, for that same imaging study, it was $290 cash. So if you have any kind of deductible like you and me do, it's almost just worthwhile just to pay the cash price and not actually go through your insurance at all. And that is exactly what a lot of my patients are finding, that, hey, it's more affordable. Your care through your clinic, these cash prices, is more affordable. Medications is a great example. Just the other day, I had a patient who was getting a common SSRI, a medication called Zoloft for anxiety, depression. Maybe you've heard of this. And she was spending about $40 every 3 months at Walmart to get this medication. Right, $40 is not a huge amount, but still something. And I told her, hey, for the exact same medication, I can dispense this from my clinic, since you're already a patient of mine, for $8 every 3 months. So $32 I'm saving you right there just for this one medication alone. Right? I mean, those are just, example of MRIs. I talked about medications. Laboratory studies, the same thing. If you look at U of M's charge master rates for something as simple as a cholesterol panel, where we're checking your good, your bad cholesterol, your triglycerides, what's called your lipids. This says on their charge master rates that they charge $160 for this one test. I charge $5.
Now, here is the problem I think we are going to have with some people.
Yeah.
They're going to be like, is this really true? Are we really getting what you would get at these places? And the answer is obviously yes. So you just tell us a little bit about, you are a doctor from obviously.
Yeah, so I mean, everything. I try to be as transparent as I can.
Sure.
From everything that you're going to get here in this information to our interview. If you look at my website later, that I mean, again, transparency. People want the truth, and so do I as a doctor. If people come to me and they're giving me one story, but all the evidence is pointing towards something else, I'm like, hey, we have to be honest with each other if we're going to move the needle in your care. And so that's sort of the same way I approach my clinic. So in terms of who I am, I went to medical school in Chicago, graduated in 2014. I did my postgraduate here in Michigan through Beaumont Hospital, not too far from here. And in fact, I trained a little bit both at Beaumont Wayne, and then I did some of my training up here in Troy as well. And then I graduated in 2017 from my postgraduate studies. From there, I worked in 1 year in a hospital-based system. I was absolutely miserable with myself. I said, it was sort of what I was alluding to earlier. Even though my name was on the door, I wasn't in charge of anything. I couldn't tell my patients the prices of anything. People were frustrated with the care I was getting. I was seeing 25 people a day. You say, oh, that doesn't sound like a lot, but when you factor in 15-minute visits and documentation and physical exams, doesn't leave a lot of room for conversing with people. And so after that, I said, hey, there has to be a better way. So I left to open up my own practice in Ann Arbor in October of last year. So I've been open for just a little bit over a year. Fully board certified. You can look me up through the state of Michigan if you want. I have a fully licensed business. I have a dispensing license as well, so that's why I can dispense my own medications. I've contracted with the same wholesalers of medications that Walgreens, Kroger's, Myers, Walmart uses to get their medications. But I turn around, I take those same medications and I sell them back wholesale to my patients, because I'm not in the business of being a pharmacist. I'm in the business of providing health care, and I add value to my practice through these other things. And then the companies I use for my labs, such as Quest Diagnostics, they're a national player here in Michigan. I'm sure most people have heard about them as well. So I mean, everything I do, every step of the way, when a person gets, say, a cholesterol panel through me, I print their results out. They can see the individual numbers, ask questions if they want, and another great feature about my practice is, I always tell my patients, yes, we can talk about things over an office visit. That's more than fine. That's what I do. But a lot of my patients, they simply, call me up. They text me a lot. And, these are things I think, again, I'm trying to be more personalized. I'm trying to extend medicine to what, people, really want in this day of age, is that personalized connection with a doctor, right?
And I totally agree with you. I think the part that comes to me, so thank you so much for clarifying that for people who may not think that, okay, we are talking to a doctor here. Yeah. The other part I think which comes back to is the system has become so confusing for the average person, and the person feels so much uneducated about the healthcare for their own health as well, that they feel they're at the mercy of the system which is available. And what we are trying to help them understand is that they can be in power, or they can be empowered to get the treatment that they need from people like you, who are obviously providing at great price, very personalized touch, etc. So suddenly now the customer is taking charge, because too many people feel like a victim. They can't do anything about the system, but you are offering them an opportunity to really feel that they can actually be responsible for their health care, and it can be done very affordably, instead of thinking that unless the government changes laws, unless insurance does this, unless the hospital does this, they don't have control. But they do have control.
They do. Going back to sort of a crossover analogy, with the cars and car insurance. If you went to get your tires replaced, and the dealership wouldn't tell you the cost of the tires, I'd be really hesitant towards getting new tires. I'd say, what if I'm overpaying by $1,000 for the exact same thing? I could go half a block down the road for and get equally. I mean, that's money in my pocket. That's feeding my family every night. And so these are real world consequences. But in healthcare, we don't do that. And for people, it's really frustrating to have those answers, because we need healthcare. We need answers. We need people such as myself who are duly board certified as physicians, and can give that medical advice to people. But up until now, we haven't really been able to discuss price with anyone. right? And that's what myself in my clinic in Ann Arbor, that's what we're trying to do, as well as hundreds of other doctors across the country in this movement called direct primary care. Right?
Very good point. And I think that's what people need to be aware, that this is an option which exists, which is legal, provides them great care, and the prices are just ridiculous. Do you mind sharing some of the prices?
Yeah, sure. So, I brought some of my brochures here.
Sure.
That flyers that I promote towards families and individuals and employers. For example, an average adult between 31 and 49 years old, for $50 a month, they get virtually unlimited primary care office visits with me. I always tell my patients pretty much anything I do in my office for that month of care is included with that. So all your office visits, there's no additional co-pays. Say someone sees me for a wellness visit, earlier in the month, and then 2 weeks later, they see me because they have a hearing issue and they just need their ears cleaned out with the earwax, and then 3 days later they come down with a flu type symptoms and need to see me for that. It's all included. There's no additional co-pays. I always tell people $50 a month for your average adult is less than a cell phone bill nowadays.
A lot less than cell phone bill.
And the way direct primary care works for most clinics, every clinic is usually independently owned and operated. But for my clinic, it's tiered based on age. The idea being, as we get older in life, our medical conditions become more complex.
Correct.
Time spent with me in front of a doctor becomes more and more, and the conversations take a little bit more time than, say, a 22-year-old who's just come in because they have a acute respiratory infection and only want to spend 10 minutes with me because they got to get back to their classes. So my prices go up, for say an individual between 50 and 64 years old, it's $70 a month. Someone who's 65 and older, it's $90 a month. But again, these are affordable prices. For that, you get all the services that you can see on my website if you want to take a look at that later. Other things, for example, a Z-Pack, something I think everyone's commonly familiar with. It's a common antibiotic that we use a lot of times to treat bronchitis, upper respiratory type infections. $1.80 through my clinic.
Wow.
I've been told people with insurance are paying upwards of $35 at pharmacies for this. Other medications like Celexa, a common antibiotic, Celexa, it's a antidepressant, 57 cents for a 1 month supply, 30 pills. Metformin, 500 milligrams. Someone uses for diabetes, usually typically twice a day, 66 cents. These are just a small sample. I always tell all my patients I stock about $3,000 pharmacy in my clinic where I can dispense these medications wholesale them, and it's a daily thing for me. I love showing my patients how much they save with me when they get prescriptions if they need them. Just today I was refilling someone. I said, hey, look, you saved with these 2 prescriptions over the course of 3 months $80 through using my pharmacy versus going to a retail pharmacy, because my computer will sort of compare and contrast those prices. I say $80 is over a month of care in my clinic that you just got basically for free through the savings. And so again, it's about empowering people to know where they're putting their money towards, because they're going to need health care eventually.
Everybody.
But my goal as a primary care doctor is to help my patients avoid those hospitalizations, avoid those surgeries if I can, through just again preventive care and getting people in a timely manner. Something I think you and me can agree on, and anyone can agree on everywhere, is that what I call delayed care is denied care.
Correct.
Meaning, if you call your doctor up and they say, we don't have an appointment for 2 weeks or 2 months from now, that doesn't do you or anyone any good.
And I agree.
If I'm sick and I have some questions about my health, please talk to me today or get me in within 48 hours. And that's a guarantee I make to all my patients, is that I will get you in, or at least I'll have a conversation with you within 48 hours to make sure that you're feeling better. Because the alternative, which I think we're seeing in this country a lot of times, people are not getting that. And they're going to other places that are more costly and less transparency, such as urgent cares or hospital emergency rooms, in which case the fees for emergency rooms is nearly $1,000 the moment you step in.
It is. I remember my son had to get some checkup done because I thought that he fell on ice and he had broken his arm. Nothing had happened. It just, whatever but I still ended up paying at least $1,000. And I was like, wow, what did I pay that for, right?
Yeah.
And I think it becomes...
I mean, a classic example, I mean, had somebody a member of my clinic, I could have saw them in my office, you could examine them, I would have sent you for the same x-ray that you would have gone done in the emergency room. Just real quickly, I'll see if I list that x-ray here. Here it says, let's see here. Hand x-ray, $39. Let's assume it was your hand. So you get the hand x-ray done for $39 or about $39, depending if we're looking at the ulnar or radius or whatever it is. And then I get that report that same day, and your son's care is already included in the membership. I'm not charging extra. You just paid for one x-ray. Maybe I give your son some Tylenol or ibuprofen. It costs less than $1, and so we're talking less than $45, and some of your time, compared to that $1,000 bill that you just got in the emergency room.
Isn't that amazing? Wow, we can keep talking, and I know it's just amazing because you're bringing so much good information to people. So how do people get hold of you, doctor?
So, people can get a hold of me. Again, my clinic is Beyond Primary Care. I'm a family medicine primary care doctor in Ann Arbor. So you can Google Beyond Primary Care or Primary Care in Ann Arbor. You'll find me, pretty much right away. My phone number is area code 734-395-2850. My clinic, of course, is Beyond Primary Care. So my website naturally is just beyondprimarycare.com. And I'm also on social media such as Facebook, Instagram, all those good places. So you can find me on there. I love to share, just family recipes, healthy inspirations, just getting back to, being a community doctor. I want to, again, I always tell people, I'm human just like anyone else. I want to have relationships with my patients and show them like, hey, I'm a real person. I like to go for runs or bike rides. I like to cook, and I want to share those things with my patients. I don't know if you followed me on social media, but just the other day, a patient, showed a funny meme joke with me on a text message, and I said, this is great. I mean, what other profession, can people just, be so honest with, with a professional such as myself to share just a simple joke? Right, and
they feel relationship.
That builds a relationship. And I said, here's a person who, I'm probably gonna be their doctor for life now because I connect with them.
Yes,
and I think
totally agree.
That's huge. And not only that, but I'm connecting with them is importantly to you at an affordable price.
Yes, very affordable price as well. Wow, what a pleasure, man. We had fun. I hope you enjoyed that. And I wish more people, and you are in Ann Arbor area, so people, if you are anywhere close to the area and you're looking for quality care at a very affordable price, Dr. Jeff Boyle is your guy. Please go visit him as well. Thank you.
Thank you so much. I appreciate it.